including family when treating the opiate use disorder population, different sort of barriers to that, and then some specific information on family intervention that's recommended for this population. So hopefully by the end of this lecture, you have kind of an idea of where including family or concerned significant others might be in terms of how you guys are doing your work with these folks. So that's our plan for today. If you have any questions at any point throughout the presentation, just unmute yourself and chime in, but I will make sure that there's some time at the end for questions as well, questions and feedback. Okay, so let's get going. I love this slide because this just highlights, I think, how I tend to think about normalizing for patients and for myself that really there are not really any normal families out there, that a lot of times the systems that our patients are coming from are not that healthy, but that doesn't mean that they can't be, right? So that's kind of going to be the crux of today. How can we sort of think about that as including family as a way to help people in general improve their lives and move forward in recovery? So let's define what a family is and what we're talking about when we use this word, whether we're calling it formal family therapy or family intervention or just family support or family psychoeducation. What do we mean by that term? Well, the term really means anyone in that person's social life that has close and enduring ties. So when you ask your client who is most important to you, that's their family. So we don't just mean blood relatives, right? And we don't just mean people that they live with. We mean people that can even be in another state, but they have close, enduring ties with and regular communication. So, for example, it could be parents, grandparents, spouses, partners, in-laws, siblings, adult children, which we're going to talk about the impact of substance use on children in the home and thinking about how can I get intervention for the children that are in the home. But I'm not necessarily going to enroll the young children that my client has in the client's treatment, if that makes sense. But adult children, we absolutely could reach out to them to say, you know, how could you be a support, or would you like to be a support for your parent? Extended family, friends, and even caring colleagues and coworkers. So pretty much family means anybody that the client defines as being someone they want to be involved in their treatment in some way. Why is this important? Well, it's important because addiction really can be viewed from a systems perspective as a family disease, that it affects not just the individual that we're treating, but it affects the entire system. It puts all members of that family, however it's defined, under a great deal of stress, and it will disrupt routines for each of those members. So we think about this perspective, that is using to maintain some kind of equilibrium in the system. If we look at it from a distance, it's easy to say, well, that's problematic behavior, just stop that problematic behavior. But if we're not looking at the whole system itself, then we might be missing big pieces of the puzzle as to why that person continues to use in spite of significant social consequences. So over time, what happens is the family becomes relatively fragile and dysfunctional, and this can contribute to the onset as well as the maintenance of addictive behaviors. We see this not just in individual families, but also in communities. So that's why we can see sort of the destructive effect of addiction impact an entire community and sometimes even over multiple generations. Now, what is the impact of addiction on children? This is important to consider because we're working with clients who themselves were once children and who might have had addiction in their family system that's affecting how they're dealing with life now, and why they might have even ended up developing an addictive pattern. But also, a lot of our clients have children themselves. And so we want to be kind of mindful, if we're treating the whole system, what interventions do those children need, or what things do we need to keep an eye on to try to stop some of those cycles. Now, children who grow up in households with addiction are particularly vulnerable. In fact, we see upwards of 70% of all abuse and neglect cases report that substance use was part of that event. So we know that it's very, very highly correlated with the likelihood that there's going to be incidences of abuse and neglect. We also know that substance use in the home really disrupts a child's normal development, and it can lead to a whole host of significant mental and emotional problems. Kids that grow up in homes with addicted parents or addiction in the home are much more likely to have difficulties in school. They're likely to have difficulties with peers. They're likely to have mood, oppositional, medical, attentional, or executive functioning issues, meaning that they're not thinking clearly. And so this pyramid at the bottom, which comes from the ACE study, which is a pretty famous longitudinal study that looks at the effect of adverse childhood experiences, shows that substance use can be one of those adverse childhood experiences that put children at risk to have a whole host of problems in basically how they're developing, how their brain is responding to the environment, which then corresponds to an adoption of high-risk behaviors, including substance use, which then lead to the onset of disease, disability, and early death. So keeping in mind that kids that grow up in these households are easily 4 times more likely to go on to develop an addiction themselves. So when we're working with the client and we're forgetting to look at that social system and that history, we could be missing a piece of that was this learned behavior. What was this person exposed to growing up? That's a pretty important variable that can help us in working with them. And then the other thing is just keep in mind that a family itself is a system, that it's really that expression, the whole is greater than the sum of its parts, right? That it itself has its own identity and dynamics, and that individuals, the person that's sitting in front of us, may look differently than they do when they go home or that they are in that social system. So they function in a particular way, kind of like a piston in an engine, right? It has one particular space that it takes up and a particular role that it plays. And it's really, really hard to get that piston to shift gears or to be something else. So we have to look at rebuilding the whole engine if we want to affect change in that one individual. So another important factor to consider is that family relationships are bidirectional and that they can be one of the primary sources of support to help people in recovery. And so if we're not connecting with family, we could be missing one of the main mechanisms of change to help people get better. But also they could be one of the main reasons why people continue to use substances or why they relapse. In fact, the #1 relapse risk is an interpersonal discord or fight of some kind. With someone close to them, when they have a bad fight, that's one of the #1 risk factors as to why they might go and use. So family relationships can be extremely healing, but they can also be one of the things that gets in the way. Family patterns will repeat across generations. I don't know if this is true for you guys where you're working, but I know in my setting, we have multiple generations in one clinic. We'll be treating the grandmother, the mother, and the daughter all in one clinic because it is really crossing the generations. The other thing to keep in mind, and one of the reasons why it's important to communicate with family is that it's hard to teach individuation, particularly in a lot of cultures that are not individually based, in the absence of understanding the need for and importance of connection. That healthy systems require both of these things. So sometimes a lot of our individual treatments, the emphasis is, right, identifying the people, places, and things that are risk for you, and how do you start to cut those out? Well, if we're asking them to cut out important people in their life, even though those important people are using, even though those important people might be triggering, we're probably not going to be that successful if we can't also understand and balance that need for connection. That it's important to have both of these things, to feel connected, but also to be able to separate from the whole when necessary. And then individual symptoms usually have meaning within the family. And we're going to talk a lot about this here in a second. So why do we have to treat the system and not just the individual? Well, substance use develops and is maintained within a family system, that it can reflect other family difficulties. So what does this mean? Well, this means that it could be the individual that is using the substance is maybe the scapegoat in that family system, that they've always been the person that had the problems, that was involved in criminal behavior or activities, that it was easy to sort of isolate and push any difficulty or stress the family was having. The reason is the client, right? So that's a particular role, and the family is not necessarily going to want them to stop playing that role, because it might mean that they have to look at some of the other issues or stressors that are going on in that system. Also, substance use can be maintained or exacerbated by family interactions. Well, we just talked about that, right? That stressors, difficulty communicating, lack of healthy connection within a family system is one of the main reasons why people continue to use and why they relapse. Another factor which I always find fascinating is that individuals with substance use disorder, adults, are 5 times more likely to live with a parent or other family member. We think that one of the factors that is driving this is because addiction is so corrosive to a person's functionality that if they lose employment, they lose housing, who do they end up having to move in with? Well, they usually end up moving in with somebody from their family of origin. What implications does this have if we're not treating that family system? Well, now we have an adult patient who is back in an environment to recreate childhood or adolescent patterns and dynamics. So we really have to be mindful of that likelihood that a lot of the folks that we are seeing are back in situations to act like children or to be treated like children, whether that's the family is aware of that or not. Also, individuals with substance use, we know this lovely thing called ambivalence is a very real thing. And so a lot of our folks don't necessarily come to treatment because they're completely in the action phase and they're ready to go and they want to make changes. I would say a fair number of them come to treatment at the behest, the coercion, the persuasion of family, that because their behavior has been so problematic and so painful for the system that they're sort of saying, like, if you don't go to treatment, we're going to kick you out. If you don't go to treatment, we're going to cut you off, right? So if we're not including family in the conversations that we're having, we might be less effective at helping that individual. And that's because of this lovely thing, because even though families are well-intended typically, because the pattern within a system always resets to whatever its baseline was, families will sometimes unintentionally sabotage an individual's treatment. They're not necessarily wanting that to happen, but it's just part of how family systems work. So we need to be mindful of that. Also, when patients get sober, that causes significant shift in how that family has functioned. And so there could be a lot of discomfort, there could be a lot of hurt or a lot of pain that needs to be managed and is an important focus for treatment if we're forgetting about it. The other thing to keep in mind is for women and adolescents, family therapy is actually the #1 recommended intervention. So if you're treating women or individuals under the age of 18 in your clinic and you do not offer family therapy or some sort of family education or craft model or something, then you're actually not doing best practice. That individual treatment alone for these populations is not recommended. Why might that be? Well, we think that adolescents are living in the family environment. How easy is it for an adolescent to make changes without some involvement of their parents? Not very easy. And then the same thing for women, that culturally women are, they develop with the mindset that family comes first, children come first. So a lot of times we see this issue, particularly with childcare, that when we're saying you need to come to your appointments, you need to do this therapy, this is what's going to help you, the #1 reason why they say that they can't is because of lack of childcare, or who's going to take care of my kid, or if I can't bring my kid to that group session, I can't come. Right, so we have to be thinking creatively or a little bit outside the box so we can make sure to accommodate the fact that women are not going to choose their individual treatment over the needs of their children and their families. So we need to be including that as part of how we conceptualize this. So why don't we do this more often? Well, there are a lot of barriers. There are barriers for clients that oftentimes they feel a lot of guilt or shame over some of the addictive behavior or the wrongs that they believe that they've caused in their life. They might have some unrealistic beliefs, things that, society gives us. It's my problem. I should be able to handle it. I have to fix it, and then I can bring them back in. There might also be things that they don't want their family to know. They could be concerned, are you going to show them my UA results? Are you going to tell them that I'm still using, right? So being able to have a really clear conversation about consent and what information you would share and what information you won't share without their complete buy-in is really, really important. Families also have similar barriers. They usually feel guilt or shame over either believing that they've caused or they've failed to stop or control the addiction. So they feel like it's my fault that my child has this, or it's my fault that my partner won't stop. If they only loved me enough, they would stop. So there must be something wrong with me. There's also tends to be a fair amount of frustration and resentment that has built by the time these folks come to us. Families have usually attempted to intervene multiple times. And so there have been multiple failed attempts that the family might feel powerless with. They might feel like there's nothing I can do to help, so the person's on their own. And then clients, because of their barriers, don't necessarily invite family or want family to be involved. We also have barriers ourselves. Oftentimes, staff, even though we are trained in really good individual work and maybe we had a couple classes on family therapy, we might not necessarily feel that we are qualified to work with family. And the next couple of slides, I'm going to go through some things that you can do regardless of having any training in it to sort of include family in the work that you're already doing. Staff also tends to have some beliefs that really come from the social stigma that the clients also have, which is that families shouldn't be involved because their family's going to shame them or hurt them or somehow make it worse. Or this belief that it's just going to be too difficult to manage all of the drama and the dynamics that the family could bring in. Or family is maybe not even in the area. So how do I contact somebody when I have to dial long distance? And then there are serious facility or systems barriers that get in the way. Having systems that don't provide enough support or training for family intervention. Sometimes our spaces are very limited. If your office isn't big enough to have 5 or 6 people in the room, how do you provide that intervention? That sometimes there's limited funding for materials, for being able to do long distance calls or like FaceTime or whatever it is to get family that's not nearby to participate, and then not providing time or administrative time for clinical staff to make those phone calls, to do collateral contact as a routine part of treatment. So what are some solutions? What are things that you guys can do before we get into the formal recommended therapy interventions? What are some things that you can start doing right away with relatively limited resources? Well, start to think about, there's a difference between structured family therapy and just engaging with family and inviting them to be a participant in your client's individual treatment. That the data is pretty clear. Engaging even just one single family member or concerned significant other can be sometimes enough to strengthen the entire family system. Having that one person who can advocate for the patient, who can partner with them to try to shift and change the system can sometimes be enough. So you don't even have to include the whole shebang and every brother and sister and cousin and everyone that's in that person's life. You can just say, who's one person that can partner with you right now in your treatment, and what's the level of involvement that you would like for them to have. But having that be a routine conversation that you offer everyone and that you provide the rationale for how that's going to help them, right? So family members can be involved at the most basic of level, learning about your program and recovery process. It doesn't even require a release of information to do this. You can just allow family to come onto the premises, provide them a brochure, discuss with them, this is what we offer. I have no idea if your family member is a patient here, but this is what we offer, right? You can have them, if you do get consent, have them participate in intake and treatment planning processes. This is really, really important. You can also, if you have a release, invite them to take part in individual sessions or group sessions and lesson plans. You can encourage them to support their family member who's in treatment by adopting a more gentle, non-judgmental, probably more informed perspective. And one of the things that I think we need to take responsibility for as clinicians is not just providing this information to family, but also providing this information to our clients, because they can't make an informed decision if they don't know how this is going to benefit them. If you just say, would you like your family to be involved? And they say no, and you say, okay, moving on, then we haven't done a really good job of explaining to them what they could get from allowing us to have contact with just one concerned significant other. So providing some of this information can be super helpful. Essentially sharing that, you know, being able to engage in treatment overall, 60 to 75%, depending on the intervention, improvement if we have at least one concerned significant other involved. Being able to stay in treatment, which we know is highly, highly correlated with success in recovery. Over 77% improvement in retention when we have concerned significant other involvement. Improvement in how the family is functioning, in any problem behaviors, stressors, pressures that the family might be placing on the client. We can help you with that. So I always give this spiel, you know, it's really hard to do this alone. And so I really would encourage you to think about who's one person, friend, neighbor, colleague, family member, whoever that could be involved in your treatment to be a support for you. I'm not going to share anything with them that you and I don't have explicit permission to share, but I think that, you know, we can provide them education. We can help them to not be a barrier or get in the way of the work that you're going to do here. And maybe even they could be a support. And then there's a lot of studies that show that we have very effective interventions specific to this population. CRAFT is one I'm going to talk about, BCT is one I'm going to talk about, and BFIT is one I'm going to talk about. But also keep in mind that the matrix model, the matrix IOP, which some of you might be familiar with or even be using, has a family education component as part of that model. And multi-systemic family therapy, which is one that we often try to offer for our folks that have really significant behavioral health and substance use issues, but has been shown to be very effective with this population. And then a numerous number of brief strategic family therapies. So ways that you can involve family, things that you can do. Well, you can provide family therapy referrals either in-house or in the community. At ASAP, where I work, we provide therapy in our actual clinic. So we have an internal referral process to be able to do this. But if you don't have that developed at your clinic, having just a list of who in the community does it can be super helpful. Being able to do that as routine care, not an exception. Everyone gets it. Sorry. Also recommending individual family for the individual therapy for the family members as routine care. This can be extremely helpful because we're trying to overcome the amount of resentment and anger and sometimes, you know, real destruction that's occurred in the family system in order to support that one client that's sitting in front of us. So having individual therapy referrals for family members can be super helpful. I think also having standard care that includes psychoeducation or workshops for family members on basic things. Having, if you have an orientation group for your clients, having an orientation for the family that explains your program, that explains what this person is going to be going through, that explains what addiction is, how it affects the brain and the behavior. How do you help somebody get better? Having education groups that are just for the family so that they can learn more about education and the things that they can do and they can say to actually have a positive impact. And then this is really important for the OUD population, training family on how to use Narcan. If we are not doing that, we are missing a huge group of people that could provide life-saving medication. So making sure at a minimum that when you orient patients to your clinic, you're saying, I need you to bring somebody from your life in, somebody who lives with you so I can train them on Narcan. Running and providing support groups for family is another thing that can happen, or being able to refer to support groups in the community. And even something as simple as just offering to give family a tour of the facility. Again, you don't have to disclose that their family member is a patient. You can just say, hey, this is what we do. This is the good work that we do. This is what it looks like. So inviting them to that first appointment, or doing something where you have maybe a direct line or a clinician in your clinic that fields all of the family phone calls. Right? So when family calls and they say, I don't know what to do with my son or daughter or my husband or wife or whatever, that this, they're doing this and I'm so upset. You don't have to ask for a release, and you don't even have to know anything about that patient. You could have a clinician that can answer the phone and say, well, in general, this is what I would recommend, or this is what it sounds like you're struggling with. Even just encouraging them to call 911 when needed can be super helpful, or walking them through what that process would look like. And then doing things for, if you're going to think about education groups or orientation for family, you can ask local businesses to donate small items, and this will sometimes get the family in the door, especially the ones that are like, oh, I don't want to have anything to do with it. I'm pissed at my family member. I'm not going to be involved. You can say, well, you know what? If you show up to this orientation and you learn about Narcan, then you could win a raffle. You could win this awesome gift basket, or you could win this bag of groceries. And that might get people in the door. So that's just something to think about. Other things you can do, offering evening or weekend groups can be really important, because oftentimes families can be a little more functional, so they might be working, they might have other responsibilities. So being able to accommodate them with having extended hours or different hours. Also, creating a family philosophy of care. So talking with your colleagues, talking with all of the people that sit on your treatment team, to constantly be saying, did we talk to a family member? Did we call a concerned significant other? Have we collected collateral? That needs to be part of the philosophy of how we actually do treatment where we work. And then allowing work with the client and the family to really help them understand each other's experiences. And again, this can be done relatively simply. You don't need to do formal family therapy to do this. This could be a couple of sessions, either individually with the family member or with the family member and the client. And our CPT billing codes allow us to do this. So you can have a handful of sessions to just provide education and increased communication. Letting the family know that they do matter, and letting them know that they can help, can go a really long way. And this can be done, I encourage this to be done at intake. So the very first time you talk with the client, figuring out who's going to be their support in their life outside of the work you're doing with them, and calling that person, sometimes calling that person with the client in the room. The other thing is to also just respect that if family says no, that there could be a lot of reasons why that's happening, and that that's okay. We don't want to get into the habit of, once we have developed a family philosophy of care, that we're labeling families that don't want to be involved as resistant, codependent, or enabling. These labels are out of date, they are unhelpful, and oftentimes all we end up doing is pissing off the family member, and then we just don't see them again. So we want to kind of get rid of those old ways of labeling family, and really just kind of keep that door open. That door is always open. You can come through it when you're ready. I'm going to keep asking, but it's okay if you say no. And then teaching and collaborating with them whenever possible, being patient, flexible, and accessible. So sort of thinking, I want to keep this on the table. This is part of routine care. And I'm just going to keep gently asking and nudging and providing information and providing opportunities for family to connect. Okay, so that's basic stuff that anybody can do, regardless of your program, regardless of your level of training. Now let's talk specifically about family therapy. So this is where we're going to get into sort of specific interventions. And one of the reasons why I recommend this so much is across large meta-analysis studies, we have found that family therapy, regardless of population, regardless of use, is the second most effective therapy after CBT. So if we don't have this in our arsenal, we're missing a huge, very effective intervention. And for women and adolescents, it's actually the first most effective therapy. So we want to keep that in mind. It is the recommended intervention for treating individuals with substance use issues, regardless of substance. So definitely for the OUD population. And that studies have shown consistently significant effects for both how the family is functioning, but also how the individual functions and decreases their use, right? So it's recommended as an EBP by SAMHSA. So why is it helpful? Well, it's helpful at any stage of treatment. You can include family, particularly education and support in the beginning phase of treatment, where we're trying to motivate and engage and encourage patients to think about positive change. We can also include it during the active phase of treatment, when the patient's really actively working to decrease their use and establish abstinence if that's their goal. And if we're not connecting with family during this time, we could inadvertently allow for some sabotaging to occur, where the patient really struggles to decrease their use, especially if other people in the system are using. And then at the tail end, or the sort of maintenance phase of recovery, it can also be really important, because what we're wanting people to do is to move into solid maintenance of recovery and to engage in life in meaningful ways. And one of the #1 ways that we do that as human beings is by having close, connected, meaningful relationships. So we can absolutely reach out to family and help them to have those connected relationships in the maintenance phase. This is a video we don't have time to watch today because we only have an hour with you guys, but you'll be getting these slides, and I highly, highly recommend that you go to YouTube and you watch this video. This is, it is a brief, I think it's like 12 minutes or 14-minute TED Talk by Johan Hari, who he was a journalist who wrote a book about, he did like a 7-year study on the opiate epidemic and the war on drugs. And he makes a very, I think, articulate argument about the need to have social connections when thinking about recovery. And in fact, if our focus is on individual recovery alone, that we are never going to be successful at fighting this epidemic. That we really have to think about this as social recovery, and that starts at the level of the family system. So I encourage you to watch this video. It's pretty awesome, and in fact I show this video to family members all the time, and it helps them to go, I never thought about it like that. Okay, I'm on board, sign me up. So this is a helpful video to have. So now let's talk about basic concepts of family therapy. Well, all family therapies fall under the umbrella of what's called systems theory. So this is a perspective that essentially says that who the person is defined within the context of their relationships, that their individual feelings, thoughts, and behaviors are not necessarily what they are in isolation, that in fact they come about and are maintained as a result of the dynamics of the systems in which they live. So any stressors or improvement that we see happen is a result of changes within those systems. So relationships, all relationships, are governed by these feedback loops, which means that I do something and then the environment responds to that something that I did, and I either keep doing it or I stop doing it, right? Or the environment does something and I respond to what the environment does, and I either keep doing it or I stop doing it. So it's this this feedback loop that's constantly going on within all of the social systems that we operate in. So since within this theory problems originate within the system and are perpetuated by the system, if we don't focus on that system, we're never going to get change in the individual. Can you just see if that's a question I need to answer now? And one of the reasons why, one of the reasons why it's important to understand that is because all families have rules and all families are impacted by stress. So families have predictable, definable rules that govern them. Whether they're aware of those rules or not, they exist. Unhealthy family systems tend to have overly rigid, unclear, or inequitable rules that govern the system that lead to dysfunctional patterns. Now, stress impacts every single system, even in healthy families, but if a family has relatively flexible, clear, and equitable rules, they can adjust to any system placed on it, any stress that's placed on it, the system can adjust. Now, families that are less healthy and have those rigid, unclear, and inequitable rules, they will not alter. So it keeps the family from changing. And this brings out this happens both like as people develop, but also as things happen in the environment. So think about, loss of employment, financial stressors, childcare stressors, everything that goes along with a person's life, not even including the impact that addiction has. How does the family accommodate and adjust to those stressors? Well, a lot of it depends on how flexible and clear the rules are. Because at its default, families will resist change, that they are always trying to maintain whatever their baseline is or whatever their homeostasis is. So that's essentially sort of the balance that the system has developed. And it will always be trying to reset that. It's this thing called equifinality, which means no matter how much the individual by themselves try to change something, they typically will end up back at the same destination, that multiple ways or paths will end up pulling you back into the family dynamic that is their baseline. So how do we deal with that if we're only dealing with one individual? Probably not as effectively as we could, right? So we have to be thinking about techniques, family interventions that will help us to evoke change within the entire system. The other thing to keep in mind with a lot of family therapy is that insight regarding their resistance to change is not necessarily needed, and that's not necessarily the goal of a lot of these interventions. That what we're trying to do is not get the family to understand their unhealthy dynamic. We're just trying to get them to do it differently so they can experience that difference and tolerate the shift that could be occurring. And so we kind of need to have contact with those important pieces. So interventions specific to the substance use disorder population and the OUD population. Probably one of the mainline interventions, which I'm sure some of you have at least heard about, if not already been trained in, is the CRAFT model, which stands for Community Reinforcement Approach and Family Treatment. So that is, the emphasis is really on helping families learn new skills to be able to interact with the family member, the substance abusing family member, in a more helpful way. So just like we said, a lot of what happens within systems is I do something as the individual, and then the environment reacts to that something that I did. I use drugs and alcohol, and my family reacts to that. Now they can either react to that in a negatively reinforcing way, or they can react to that in a positively reinforcing way. So CRAFT is really about teaching families to positively reinforce the individual. So I reinforce the behavior I want to see, and I ignore the behavior that I don't want to see. So over time, the behavior that I want to see ends up becoming the predominant behavior. It allows loved ones to face natural consequences. So it takes family member out of the dynamic of trying to prevent or keep them from going to jail, or keep them from losing their housing, or whatever it is. It allows natural consequences to take place, but still being that positive, supportive person in their life. So some of the things that CRAFT will attempt to do, it helps family members learn how to manage dangerous situations with the substance abusing family member, like acute intoxication or withdrawal, and also like suicidal, homicidal stuff that might be showing up as a result of the substance use behavior. It also helps them to remember that they have a huge impact in the positive sort of reinforcement that they provide. So essentially reminding family, forget about all of this addiction stuff, forget about the drugs, let's take the focus off of that for a little bit, and let's have you build back your relationship and your connection. So one of the main things that we teach people is this thing called daily reminders to be nice. So you give the family members a checklist of things that they do every single day, like say thank you, ask can I help you with anything, express that you appreciate the family member. Stuff that has absolutely nothing to do with whether they're using or not using, you do it regardless. Because if we can support the connection, then over time, the substance using individual will start to shift their attachment to the drug to their attachment to their loved ones. It also teaches them how to do all kinds of more healthier communication. So being able to provide non-judgmental feedback, and to practice this thing called reflective listening, which our families usually are not very good at. We also help them to learn how to discontinue the things that are not effective, that might be inadvertently sabotaging or positively influencing the substance use. So doing things like, you have to quit or else, or just, have you stopped drinking? Did you drink today? Or whatever that kind of nagging or pressuring or coercive behavior might be, to help families to step back from that, because we know it doesn't help. And then thinking about what are the ways that they can support abstinence by increasing and positively reinforcing abstinence. So doing fun activities together, making sure that there isn't anything in the home that the individual can use. I can't tell you how many times I talk to family and they'll say, well, we don't have any heroin in the house, but they've got alcohol in the house, and they've got prescription opiates in the house, and they've got marijuana in the house. And it's like, okay, we need everybody on board to agree that for a period of time, none of this will be in the family. We're all going to be sober together, at least for a little bit, right? Let's create that environment. So we help them to think about things like that, and then doing sober, fun, reinforcing activities together. And then reinforcing, practicing to not react to use behavior. So this thing called extinction, where if that's the behavior I don't want to see happen, that when it does happen, I just go, okay, you used today. What do you want for dinner? Right? You move on. You don't give it attention. You make it not the priority that usually is what's happened in the family system. So over time, you can extinguish that dynamic with the substance user. And then you provide a space for the family member to initiate treatment themselves, and to think about things that they can do that's reinforcing. There are couples approaches that do a very similar thing. ABC is one of those, and behavioral couples therapy for alcoholism and drug abuse is another one. These are couples approaches that do a very similar approach to craft. They have been normed on drinking, but they have also been shown to be effective with pretty much any substance use. But they help the family member to figure out, how can I disentangle myself from this unhealthy pattern that we have, and reinforce the behavior that I want to see, and just ignore the behavior I don't want to see. It also provides some specific interventions to help the couple repair the damage, the hurt, the wounds that might have been caused as a result of some of the ongoing use. All of these interventions that we're talking about today are present. They are present and future focused, meaning we're not going to stay in the past, because we can't change that stuff. We're going to try to stay either in the present, or think about, where do you guys want to go? ABCT and BCT, these are treatment programs. They tend to be a longer session, so 2 to 3 hour initial assessment, and then 60 to 90 minute sessions, but they are meant to be brief, so they can be delivered in 12 to 20 weeks, depending on what the couple needs. And then really they are optimally done in an outpatient setting. Another piece of it that comes with these is, anytime we're doing couples work, we always want to be aware of the influence that substances have on increasing aggression in the relationship and violence in the relationship. So one of the things that is cool about getting people into these treatments is we sort of prioritize, okay, any aggression, psychological aggression, sexual aggression, physical aggression, it stops today. This is what you guys are agreeing to do. And if it comes up in the course of the treatment, you deal with it immediately. So that way you can give them a whole slew of techniques to decrease the likelihood that there's going to be some kind of ongoing violence in the relationship. Some major focuses within both of these interventions is motivational enhancement. So people don't have to be totally ready to commit to change. That's okay. It is not a confrontational approach. It is neither one of these approaches force sort of like, you have to change or else. That what is that TV show? Intervention, right? It is the complete opposite of intervention, right? We don't want to threaten the relationship. We're saying, I'm in the boat with you. I'm here to support you. If you do this and this, I'm going to take myself out of the boat for a while, but I'm not going to leave you, and I'm not going to stop loving you. So that's a different shift from some of the stuff that society might think about is helpful for families. It also comes from CBT, so there's a prioritization on teaching the both couples how to do things like functional analyses, high-risk situation, high-risk situation planning, trigger identification. So you're teaching both the client and their partner how to do these core CBT and relapse prevention techniques so that they can support them. So if they do use, they're able to say, okay, let's break that down. What happened? What do you remember thinking or feeling right before you used? What were those antecedents? And then what are the strategies that they both need to use for relapse prevention? It also focuses on improving communication and improving positive interactions and activities with the couple. And I think this is really important, and we cannot forget enough that when we ask people to stop using the one thing that makes them feel good or helps them manage pain or helps them deal with their psychological traumas or anxiety or depression, and we have nothing to offer as a substitute for that, they are much less likely to be successful. That we have to think about increasing all of those positive social reinforcers in their life. What are those fun shared activities that have gone away or have stopped or have become so contentious that they are negatively reinforcing? And how can we shift that so that when you guys are together, it is enjoyable and connected? This other one, this last one, is called Brief Family Involved Treatment. This is sort of an investigational treatment, but I believe that it is going to be normed and out there soon. So this is sort of looking at, in 3 sessions, what can you do? And a lot of change can happen very quickly, that we don't have to wait for 20 weeks for somebody to change. It helps family members to be more successful in supporting their client by, again, improving that relationship, improving the quality of the interactions that the family member has, and reinforcing the change that you want to see. So I think you guys are picking up on a bit of a pattern here with all of these interventions. So BFIT includes 3 main kinds of interventions: family support for change, which has all of these different components to it. Reciprocity enhancement, which means if I do this for you, you're agreeing to do this for me. So increasing that positive interaction and getting out of sort of a tit for tat, I'm only going to do this for you if you do this for me, which is a less healthy way of interacting. And then supporting communication. So a lot of communication skills are taught in just a very brief amount of time. Being able to shift the whole family system, interdependent of what the individuals do, looking at the pattern of the interaction and how that can change, and then the what are sort of the behavioral targets or the practical things that you want to walk away with in the next 3 to 4 weeks. So all of these strategies are available out there, and I have some resources for you here. This is a website, multiple websites. Smart Recovery is a good resource that pulls a lot from craft and has these really nice sort of standalone worksheets that you can get. Here's a website and resources for ABCT, and then this is one for BFIT. So in summary, don't forget, context is more important than content, that it's important to understand the actual relationship and place less priority on what's being said, but the actual dynamic and how it's being said, that all people are complementary, and that they're going to compensate for whatever's going on in their environment to constantly move towards that equilibrium. But this is good. It creates a number of workable problems that as therapists, we have a skill set, or we can get additional skills to be able to help course correct. That families and couples are constantly engaged in these kinds of circular exchanges, whether we treat it or not. So we might as well take it into account and try to help them find some more effective solutions. That in fact, the entire family system will benefit from taking part in some of these interventions to help them change their feedback loops, to be able to interact with each other and shift that entire baseline to a healthier, more flexible, fluid way of interacting. And that resistance to that change is normal, and that we expect it. Just like we expect there to be resistance with any kind of change, we don't think families are any different. We don't want to fight it, but we want to just create the space for some of those conversations to occur. So what questions do you guys have?